welcome you to the Northern Colorado Healthcare Careers live virtual chat. And I wanted to let everybody know that we are going to be recording this session. Our focus today is on in-demand careers that are in Northern Colorado. And our event today is hosted by the Northern Colorado Healthcare Sector Partnership, which brings together key stakeholders to promote and improve health within our communities. With industry at the forefront, we collaborate with education, workforce development, economic development, and other community partners to seize opportunities, respond to the changing healthcare environment, and solve collective problems and celebrate the successes in our region. My name is Chris Houston. I work with Front Range Community College as the Director of Healthcare Apprenticeships. And I would like to have our panelists introduce themselves. So today we have on board Jessica Romero, who works as an LPN with Columbine Health Systems. Jessica, thank you for joining us. And we also have Molly Wilson and Lucinda Womack from Associates in Family Medicine. And then I'm also happy to answer questions regarding educational opportunities with Front Range Community Colleges and other educational systems. So I'll start with Jessica. Jessica, would you like to introduce yourself? Tell us who you are, your role and your occupation in the organization.
Yeah, hi, my name is Jessica Romero. I am at LeMay Avenue Health and Rehab, Columbine Health Systems. I am a licensed practical nurse, or LPN, and I work as a floor nurse upstairs and downstairs.
Thank you, Jessica. And Lucy, I see that you've joined us. Would you like to introduce yourself? And Lucy, you're still on mute if you're there.
Hi, sorry everybody.
You're good.
You'd think that I would have done this before. My name is Lucy. I'm a registered nurse. I work with Associates in Family Medicine. I work with a lot of our new hires. I do lots and lots of training and work closely with Molly to administer our apprenticeship program for medical assistants.
Thank you, Lucy. Is Molly on as well?
Yes.
Oh, hi, Molly. Would you like to introduce yourself?
Sure. I am, hold on just a second. Sorry, Lucy and I are in the same room, so we have to like turn our audio off when the other one talks. I am a nurse here with Associates in Family Medicine. I work as the clinical educator with AFM. So I do a lot with our new hires and our onboarding process, as well as teach our medical assisting apprentices through our apprenticeship program here at AFM. So a lot of interesting things that I never really thought I would be doing as a nurse, but I'm here and it's great.
Wonderful. Well, thank you. I know you guys are in the midst of interviewing, which is great for all of these job seekers to hear about. Just as a couple of reminders for our audience, we're asking that you are muted and that your screens are muted. You can use the chat box for questions at the bottom, and Amber will be moderating the chat so that we can pause during our presentation to answer those. You can also use the raise hand feature. It's towards the end of the chat. If you'd like to ask questions out loud, we can unmute you. And then I think we'll have plenty of time today so that we can get to everyone's question. But again, just as a reminder, we are going to be recording our virtual chat today, and that recording will be available on our website, which is nocohealthsector@gmail.com. And we can write that in the chat for you. All right. Well, Jessica, I'll start with you. You mentioned that you're an LPN. Can you talk a little bit about your certification, what an LPN is, and where did you complete your training?
Yeah, of course. So an LPN is, I would say it's like a step below an RN. So here, the responsibilities of an RN and an LPN for a floor nurse are relatively the same. The only thing that I can't do here is I cannot be a charge nurse. But so as an LPN, I received my degree from or certification from Front Range Community College on the Larimer campus. Yeah, what other questions?
You had gone to Front Range, so that's great. And how long have you been working as an LPN?
I haven't been an LPN for 6 months, but I have worked at this facility for 3 years. I have been a CNA here prior.
So one of the things you were mentioning in the training is kind of that we call stackable or scaffolding the certificate, starting as a CNA and then working as an LPN. So in addition, you have some people go on to become a registered nurse, correct?
Yes, absolutely. And I am definitely working towards that currently, but yeah, it's where I am right now.
That's great. And it's wonderful to get all that work experience. So wonderful.
Yeah, definitely.
Well, Molly, maybe you could tell us a little bit about your credential and a little bit about the training that you completed to get where you're at.
Sure. I am a bachelor's prepared nurse. So I have my BSN. I've been a nurse for 10 and a half years, actually. I went to school at the University of Nebraska Medical Center in Omaha, Nebraska. I started out, I was a CNA prior to nursing school as well too. So I worked as a CNA and then I worked as an anesthesia tech for a while. I started off my nursing career in med-surg in the hospital there in Nebraska. Worked at the med-surg unit for probably, 7 or 8 months before I transitioned to the neonatal intensive care unit, where I was there for about 2.5 years. Loved every minute of it. It was wonderful. I guess I should say I didn't like the nights, but I loved the NICU. It was a fantastic experience. We decided to move to Colorado. And so when I moved here, I had one small child, another one on the way, and was really looking for something different other than the hospital environment, which I landed on Associates in Family Medicine. I started there about 7.5 years ago and have worked with a provider. I've worked as a team in many of our offices. I transitioned to a nurse manager role. And then I've been the clinical educator for about 3 years now. So many different roles, I think is the really cool part about a nursing degree is there's so much, there's a lot of things that I never really thought I would do, such as nurse manager or clinical educator or doing a medical assisting apprenticeship program that are so very possible with a degree in healthcare.
Sounds like you've never been short of a job.
I haven't. I've held multiples at the same time too. I guess I was also like one of those insurance screener people or something that did like your cholesterol and stuff too. So you can do worlds of things.
Wow. What immense amount of experience. Thank you for sharing. Lucy, would you like to talk a little bit about your degree and your training?
Sure. Yeah, no. So I graduated with my associates in nursing from Front Range Community College. So I was proud to go there. I thought I got a great education there, honestly. And then I actually did my final preceptorship here at Associates in Family Medicine and was lucky enough to be offered a job as soon as that experience was over. So I got a lot of great experiences working with the entire lifespan. Basically, we call it like pre-cradle to grave, and everything in between, which is really great, including a lot of acute care experiences and urgent care. I was able to finish my bachelor's degree while working full-time, which is also another cool thing about healthcare, is I think that there's a lot of great opportunities to continue your education and be supported in that. I think a lot of the people who employ healthcare workers understand the need to further that. So I think most of it, hopefully Jessica, you're experiencing that at Columbine, but lots of support in continuing your education and learning to do new great things. So I felt supported in that. Like Molly, I worked as a clinical manager. I did a lot of hiring, a lot of interviewing. Also got these really great opportunities to work with Front Range and Ames Community College and the Department of Labor to create new employment opportunities, new educational opportunities, because our field is pretty short-handed right now. So all of you listening, we need you very badly. So please come work in healthcare with us. It's rewarding, it's demanding, it's awesome. You get to do a lot of cool things, but there's a lot of, I echo what these two ladies have said, and there's a lot of opportunities to do lots of different things that will fit in almost with any personality and any skill set.
Thank you, Lucy. I think what I really hear all three of you saying is not only have you had the opportunity to scale your credentials and starting from CNA to LPN to ADN to a BSN, but you've been able to work in a large variety of settings. So kind of moving on just for our job seekers. And Amber, is there any questions that need to be addressed?
No, not at this time.
Okay, thank you. Feel free as we're going through, if you have specific questions for our panelists or if you need further clarification, just to type that in the chat box and we will expand on that. A typical day, I'm sure that that's varies for everybody and especially with COVID, but give us an idea. I'll start with you this time, Molly. What does your typical day in your role now look like?
So my typical day in my role, my typical day is I work a lot with our new hires. So we hire our clinical staff on kind of a rotating basis every 2 weeks. And so I make sure I get their schedules done and who they're training with. I set up all of their kind of accounts for certain things. I have that communication with them early on as to what their schedule is going to be like, when we're going to meet. COVID kind of made things a little bit different because our onboarding process for orientation and such would take in person about 2.5 days of me saying the same stuff every 2 weeks to new people. So we have now created virtual versions of all of those things. So I've become really well versed in video editing, which I never knew I thought I'd have to use. So that's a whole new thing. So now we've kind of transitioned to doing a lot of virtual onboarding, but that's kind of opened up a really cool and awesome way to learn and be able to get that same message across to different people and be able to incorporate different aspects of things, which has been really interesting. And being able to have that education to a widespread audience in the same manner versus having to do it in person all the time. So that takes up a lot of my time currently. During apprenticeship time, which we're kind of entering that because we're coming up on our spring semester here. We're doing interviews all day today. And during that time frame, I teach mainly Monday through Friday, 8 to 12. I teach the clinical and medical assisting laboratory courses for our apprentices that are here at Associates in Family Medicine. I also schedule their experiences in clinic. So we get them time either anywhere from 2 to 3, sometimes 4 half days a week in clinic during the apprenticeships portion of that. And we really try to target different things like working with an OB provider or sports med or doing different things. So it takes a lot of brain work to get those done, but we try and make our hands-on processes really helpful. So that takes me through a good, 12 weeks of the semester. And I kind of filter in all of those education things I do here in between there.
And we do have a question in the chat. So it says, I'm a career counselor and I'm working with someone who is interested in a helping profession, so possibly healthcare. She is pretty certain she doesn't want to work in a hospital setting. What is the likelihood she can find an entry-level role outside of a hospital setting? Should she expect to serve her time in a hospital before moving to another facility or role?
That's a great question. Lucy, do you want to, start with that? Because you were explaining you didn't really start in a hospital either, right?
Yeah, I can, sorry, let me fix my sound here. Okay. Yeah, I can take that. So I, when I started out in nursing school, I kind of always thought I would be, emergency room, ICU. But in my experience, I did a lot of nights as a student, which were really, really hard on me. So to answer your question, I would say no. I don't think that you really have to serve your time. And now it could be different in different geographic areas and depending on what she wants to do. But there's a lot of nurses based in community settings, whether that be an urgent care, a family practice, a residential facility. We have a lot of nurses that work in jail and prison systems, that work in public health, that work in specialty clinics. I mean, that work in the schools. There are lots and lots of different options. In fact, if she doesn't want to work in a hospital setting, I don't really honestly think that would be a problem. I'm looking at Molly to see if yeah, no, I mean,
I think we might have
I really
lost.
don't think it would be a problem.
Well,
And just to tack on to what Lucy had said, I think especially in a family practice, outpatient ambulatory setting, we employ EMTs, MAs, LPNs, and RNs in our setting, and a lot of people right out of the gate. Now, it's a little difficult. We have to balance that a little bit with how much experienced folks we get and how many fresh out of school we get. But absolutely, we employ a lot of fresh out of school people. So that is, it's nothing that you really got to pay your dues. There's probably some positions where you kind of have to pay your dues, but that does not mean you can't get in somewhere and get in the door.
Thank you, Molly. Jessica, maybe expanding on that and asking the follow-up question, did you choose to start, why did you choose to start in the hospital setting? And then maybe you could tell us about your typical day.
Yeah, so I mean, I here is like a long-term care rehab facility. Columbine hires right after graduation. They hire new graduates. That's kind of their big thing there. I decided to start here just because it was an expansion on my CNA, and I just felt like this was a really good foundation to get before I moved to a hospital. So here as an LPN, my day varies. It's never the same, but it's always interesting, I would say. I typically have around 25 patients per day, which sounds like a lot, but that's kind of what happens when you work in long-term care or rehab. I typically will get report, and then I pass meds and do treatments. I do everything from changing catheters to doing breathing treatments to doing wound care to doing medicine, and it varies every single day depending on where I'm working and depending who I'm working with. Downstairs in rehab is a little bit more of acute care, so we tend to see more IVs and stuff like that. But upstairs, it's a lot more just comfort care and taking care of them here. So that's kind of that.
Thank you, Jessica. And maybe could you just comment on how things have changed with COVID in your role?
Yeah, absolutely. So right now we have a set quarantine hall in our building. So all of our COVID cases that we have coming in or that we find positive are going down to our quarantine hall. I mean, here we have to wear masks, we have to wear glasses in every room. Some of the halls that are on quarantine because there was a COVID case down there, we're having to gown up in every room. It does take a lot more effort than what we used to be doing, but it's definitely for our protection and for safety.
That's great. Thank you. Lucy, did you want to expand a little bit on your typical day? I know you're also involved in some of the hiring and maybe expanding on some of that too.
Yeah, hiring is a challenge. We definitely need folks right now. It's, I think, becoming more and more challenging because we've got a lot of people who are maybe out of the workforce, working with kids at home and, working through that. It's challenging. We also just need more people in clinic. In terms of hiring, AFM hires really, like Molly said, across the spectrum. We hire a mix of MAs, EMTs, LPNs, and RNs. Really what we look for is somebody who's going to be a good cultural fit, who wants to help people, somebody who's a quick learner. It's got to be somebody who's not afraid to kind of shy from some of the technical stuff. In this time of COVID right now, there's a lot of we take a lot of precautions to protect ourselves and our employees and our patients, but like Jessica, we're wearing masks, we're wearing a lot of protective gear, we're in direct contact with some of these people. So in looking for the right people that want to help our communities and get out there, but will still keep themselves safe, that's sort of what we look for in hiring. I'm trying to think here. People with experience are great, but it's not required. A lot of times, in speaking with people who are afraid maybe that they'll have difficulty being hired in the field because of their lack of experience, I always encourage them to really draw on their previous skills. So for example, maybe you only worked at a grocery store for 2 years. Well, that's customer service. That's really important to our field as well. So I always encourage people to kind of draw on those skills, because that's something that when we're looking to hire people and interviewing people, that's something that Molly and I look at. We look at past work experience. It may not be directly medical, but there may be other things that really are going to lend itself very well. In terms of my typical day, I'm sorry if I'm taking these totally out of order, but in terms of my typical day, when I'm not helping out with the apprenticeship program or training, I am what they call a team. And the team is basically there to help everybody. I walk in the door and people are usually very excited to see me, because that means I'm there to really just help pick up all the slack. So it really is everything from refilling medications, to giving immunizations, to flu swabbing people, to taking vitals, to rooming things, to getting EKGs. I don't know, if you're somebody that likes a lot of action and doesn't want their day to be the same, this is a great career for you.
So we have a couple more questions coming in.
Thank you, Amber.
First, how long does it take, how long does CNA or LPN training take? And then Dave's heard that some hospitals offer free CNA training. So is there any information on that?
So I'm sorry, I'm just kind of skipping through. How long does the CNA or LPN training? So I'll start with the CNA component, and then Jessica, I'll come to you. The CNA Certified Nursing Assistant program at Front Range Community College is typically 5 credits. And what that includes is some lecture component to learn about the basics of patient care, some hands-on skill orientation, and then a time period spent out in the community. So that can be completed in typically 1 semester. Jessica, do you want to expand on that and also talk about your LPN training at Front Range?
Yeah, absolutely. So with CNA, there is a geriatric education center through Columbine that also offers a CNA program. They take students when they're 17 years old. It takes about 2.5 weeks to get through, and then the testing and stuff that is needed to be done to get your CNA license is sometimes a little bit spread out, but there's a temporary license given so that the student can be hired right away. There are scholarships offered through the community that can help, but not necessarily free. And then for an LPN, my LPN training took 2 semesters, so 1 year. That does not include the prerequisites that I took. So all in all, probably a 1.5-ish.
Perfect. And as far as does the Northern Colorado Healthcare Partnership do any of that? No, we partner with our educational providers and our workforce partners with those programs. And there's some more information on our website, but I'm also happy to put my email in the chat box and refer you to some of our program directors at our campuses. Do you want to, Amber, go to I can read the next question.
Sure. The next question's for Lucy. And based on some of the previous information that you stated, this person has a question about, are there any techniques you'd recommend beyond website applications to get on a hiring radar? Because she feels as though the applications that are being submitted are going into a black hole.
Okay. So I know that it can be kind of tricky sometimes because it looks like you're an EMT, Sally. And I think that maybe some of my suggestions for you as an EMT is to think outside the box. You know, a lot of people think that EMTs can only work on an ambulance. And whereas that may be where the vast majority of them are employed, I may encourage you to really just to kind of think outside the box. Associates in Family Medicine is a clinic that does hire EMTs. I think that there are other clinics out there that hire them as well. Since you're missing, it seems like maybe some of your certifications that some people would look for, I think it would be really important maybe to work with somebody on developing a strong cover letter or just finding ways to bring your other skills to light. You know, I had mentioned like somebody who worked at the grocery store or at a restaurant, or people who did a lot of volunteering. I mean, those are like honestly skills that we look at. And I think a well-written cover letter really goes a long way. I always read cover letters. I love them because it gives me a little bit of personality. It can really make somebody stand out from a page. So in terms of being an EMT and struggling, I would encourage you to kind of think outside the box, think about some other places that you could maybe put those skills to use, and just make sure you're really drawing on some of your previous experiences, even if they aren't directly medical related.
Thank you, Lucy. And just to follow up with that, Sally, Front Range Community College does have a career services center at each of our campuses, and we have advisors there that can help review cover letters. So to Lucy's point about expanding that, feel free, if you can't find it on our website, the career services, to reach out to me and I'll put you in contact. All right, so moving on to your favorite thing about your job. So Jessica, I'll start with you again. What is right now, I know this is an incredibly stressful time for many people in healthcare, but many people are choosing to stay. So what do you love about your job and what keeps you coming to work?
I absolutely love our nursing team here at LeMay. Our nursing team, I've never felt like I can't ask a question. I've always felt supported here. It's the nursing team here, we just work so well together, and management is always willing to pitch in, which is always super, super helpful. And you don't just see them just sitting in their offices and, you know, closing their doors. They're up and out and helping the CNAs even, and helping us. And I just feel like if it's a stressful time, I'm not alone, and that there will always be somebody to help me.
You know, I think that echoes, Jessica, the concept that when healthcare providers are training, we really get a lot of training in teamwork, because everything to take care of a patient involves a team. And so what I hear you saying is that's really echoed not just in your patient care, but just in your general support. So a very team-focused career. Molly, how about you? What's your favorite thing?
That's hard.
Okay, you can have two.
Hard because you love it all?
There's a lot of aspects to my position that I have now that I really enjoy, and I have a lot of flexibility with what I do currently and a lot of autonomy. I'd say a lot of what I really enjoy right now is being creative with the education portion and how we're pushing out education to both our new hires as well as the apprenticeship program. I'm really trying to kind of think outside the box in terms of how we can educate and still get our hands-on experiences and make things really engaging for not only our staff but our students as well.
Thank you. You know, I think we at Front Range have also seen that once someday, when we're not dealing with an everyday COVID situation, there's a lot of things that came about that are positive for both our faculty and our community and our students. So I love the fact that you're looking at new ways to do things that will stay despite the changes. So that's wonderful. Lucy, how about you? What's a couple things that you love about your work?
I love that every day is different. I could never be a person that came into the job and had every single day be the same because I think that would make me crazy. I love that I learn something new every day. I learn a lot when I train people and they ask me questions I've never thought about before, and we have to go find the answer together. I love supporting our patients. I mean, that's probably the number one for me. And in working in family practice, you get to develop these really unique connections where you get to know entire families over generations, and you really become a trusted partner in their lives. And that's really meaningful to be that person in someone else's life.
Well said, and I echo that. I think that the relationships that care providers have is very real and incredibly caring. So thank you for all of that. So along those same notes, Molly, I'll start with you on this one. The challenging thing. What is the most challenging thing about the role that you have and the job that you do?
Well, I think there's a decent amount of challenges right now.
Mhm.
Staffing is definitely one of those. Not having enough staff, because we've had a lot of growth within our company as well. And so that's always a challenge, and people move on to do something different or whatnot as well too. So we're kind of constantly on looking at staffing, but I think it's a challenge in itself, but it's also a really cool thing as a company. But I think staffing is probably my hardest thing right now, and trying to also, the big thing as an educator that I find is I can create something to where I think it's really understandable and it makes sense in my brain, or the process makes sense, but it doesn't always make sense for everybody's learning style. So I've been trying to kind of think outside the box to really make it better for people who learn a little bit more visually, I get a lot of feedback from people as well too. And sometimes it's not the greatest feedback that I want to hear, but it helps me move forward. So that's been a challenge to work through that, because it takes extra time on my part, but it's really helpful for moving forward in what I do.
That's a good explanation. And I think for the group that is joining us, looking for these careers, I think one of the things that we know for a fact is that healthcare is growing. We have an aging population. We have more people insured than ever before, and there's some incredible opportunities. And so listening to the demand for healthcare shows you the ability to get into a role and be employable for a long period of time. So, and I too agree with you, Molly. Sometimes I think I taught it perfectly and then nobody got it. So I echo that. Jessica, how about you? What's most challenging for you, kind of in general, or maybe you're dealing directly with some COVID patients? What's challenging in that aspect for you?
I think right now what's challenging is things are always changing, and I think it's hard because everybody expects you to have all the answers all the time. And I think the hardest thing is being expected to have all those answers, and you just necessarily don't always know the answers. And so we just kind of have to go with the flow with that. And then just with that, with like procedures and policies and stuff, knowing the answers, but also just kind of as a newer nurse, all the CNAs and therapy, and they just expect you to know everything about every single patient, and it's not necessarily the case. So I think that's the most challenging thing.
Yeah, I mean, especially in a long-term care facility where the patients have been there for a while, you're still new and getting to those relationships and understanding those patients. So I can imagine that would be hard. So
yeah.
All right, Amber, any pause for questions needed?
Nope.
Okay. Well, what I'd like to move on and talk a little bit about would you recommend your profession or a profession in healthcare to this group? And kind of, I know it echoes with the why you love your job, but help our group understand, why is it a good time to get into healthcare? Lucy, I'll start with you.
Well, there's, I think, a lot of good. Oh, Molly left and did not turn her volume off here. Hold on. I'm sorry. time of COVID are just wonderful. So why would I recommend it, and why would I recommend it? There's a lot of reasons why. If you love to help people, it's for you. If you don't love to help other people, you should probably forget about it and maybe go on and do something else. Job security is huge. I mean, it doesn't have to be all about helping people. There's got to be, you know, a good financial incentive for us also. And I've got to say that, you know, nursing has always been stable and it pays well. And there's a lot of opportunities. So that's, I think, another reason to recommend it. I also think that, you know, a lot of people think, you know, nursing and they think hospitals, and that's just not, I mean, there's just so much that you can do. There's a lot of, so really I would say, yes, I recommend it for helping others, for the options to work, and for the financial security that it can bring.
Well said. Well said. How about you, Molly? What do you think are the reasons to get into healthcare?
I probably echo a lot of what Lucy said. I think the variety, the ability to shift focus or shift your career, basically. I think in particular, I speak in particular in nursing. Like I said, I never really thought that wasn't my aspiration to be at a clinic. I didn't honestly probably really know what nurses did in a clinic. I never really thought I was going to be a nurse manager. I never thought about education, but those things kind of just came naturally as I progressed through my career. And those were certain interests that kind of came through. I think that's the beauty of healthcare, is there is such a huge, vast amount of things that you can do. And working your way up, there's nothing wrong with that. Starting as a CNA and saying, which is a shorter certification, to say, you know, do I really like the healthcare system? Is that something I really want to be in? Is a great way to start it. And we see a lot of medical assistants as well, because the medical assisting program is a fairly short program as well, to really dip their feet into that. We've seen it at people as a second career that start out and they want to see, okay, well, I want to see if I really want to go to nursing, because it's a little bit more of a commitment. And I think that's the beauty about it, is that there's so many opportunities. Healthcare is going to be around forever. Mm-hmm. There's no shortage of people that are needed. Yes, that kind of fluctuates in a pandemic, of course, but healthcare is really one of those careers, in my opinion, that is longstanding. It's going to be here. It's not going to phase out.
Yeah, and Molly, I agree with you on that comment about that. There's lots of points in which that you can work in the field while you're training. You think about an engineer, they go to school and then they do an internship and they work. What if they don't like it? I mean, the nice thing about healthcare is there's so many entry points that are low time and fairly low cost to see how you like that field. So I think and it sounds like you've been able to follow some of your strengths and some of your passions in getting into management and health education. So those are great opportunities. Jessica, how about you? What are your thoughts about starting a career in healthcare, and why do you think that's a good idea?
Well, I think in my job, particularly, you can make a difference in patients' lives every single day. I mean, you're helping them every single day. You're kind of like their light, like you're the light of their life, especially now when we don't have families that are allowed in, and we don't have, anybody that's allowed in, and they're barely even allowed to do activities. That, special time that you get with them is so important, and they just light up whenever you just kind of sit there and just talk with them for a little bit. And then, also it's awesome because, like the other ladies said, there's so many opportunities to advance in nursing. And I mean, it's crazy, all the different directions that you can go. And obviously job security is a huge thing right now.
Yeah. Jessica, I know that everybody on this panel either knows somebody or has somebody whose family member is in a long-term care facility. And I cannot thank you enough for the work that you guys are doing to take care of all of our families and putting yourselves at risk. So it's a real power tribute to kind of, like you said, you are the light of those people's lives right now. And we thank you for that. So I appreciate that.
Thank you. We appreciate that. We do everything we can.
I don't see any other questions. Please type those in if there are specific questions for our panelists, or other details that you'd like to know. I think I'd like to move into, and I'll start, Lucy, with you on this one, a little bit more about the hiring. Like, what are some of the things that you look for? You know, you mentioned customer service as an important aspect, but kind of talk a little bit about those soft skills that you're looking for when you're hiring.
Soft skills that we look for when we're hiring. Yeah, those are definitely important. You know, coming to interviews, you know, dress nicely, like means well. It doesn't mean you need to be in a suit, but it does mean that, you know, you're prepared. It means using, you know, appropriate eye contact. You know, in the times of COVID, that's even changed. Like in an interview setting, we still do interviews. We do them virtually, but we also do them in person. But expect, like right now, Molly and I may be in the same room, but we're sitting about 10 feet away from each other, you know, facing like different directions, you know, come prepared with like the mask on. I mean, it's really different. Get used to maybe not shaking hands, because that's not also something that we really do anymore. Really watch your resume skills. Make sure that they're proofread by somebody that you trust. I saw here on the chat that you put up the link for the center, which those are great resources to use. Things that really stand out to us, I know when we interview people, is even that nice personal touch. You know, a thank you, like a brief thank you extended, like can really make you stand out from a pile of applicants. And that doesn't mean that it needs to be anything excessive, but I mean, sometimes just dropping a brief thank you on really, I mean, it just makes you stand out. Other soft skills, make sure you return calls, change the voicemail on your answering machine so that it sounds more professional. If I have to leave you a message, make sure that, what's that? Oh yeah, watch your ringback tones. Molly just mentioned, yes, that's really important as well. Make sure your messages are deleted so I can leave you one if I'm calling and I'm trying to schedule an interview, because that's a common problem is voicemails are full. Molly, what else?
Have someone proofread your resume.
Yeah, I really, and just like the editing and the proofreading of the resumes is really important. I can't tell you how many that we've gotten that are that have errors that are really inexcusable. I mean, somebody, like, we all make mistakes, I get that, but somebody could have caught that for you, and there's no reason for that to be on the final document. The other one Molly just reminded me of would be practice interview questions, and sometimes that means the hard ones. Like, we expect you to get the softball ones right, but expect some hard ones. And if I ask you about your faults, I would really like those to be real faults. I mean, you can answer those questions creatively, but don't tell me that your fault is that you're too perfect. I'm not going to believe you, you know? So
You're not interviewing Mary Poppins.
no.
Okay.
Oh, and follow-up questions. Let me just add that too. That is something that's impressive. So if you go to an interview, I think just prepare a few to ask, because that means to me that you care and have researched the position. And those don't have to be real in depth. They can be asking more about the benefits or asking what our team structure looks like. But we all really like follow-up questions as well.
Thank you, Lucy. I think, kind of to summarize some of what you said, is be professional. And I think I echo that in helping students find work. And there are a lot of resources to help with that. Workforce centers, Front Range Career Services, even your friends, your parents, just have another set of eyes. Record yourself doing a mock interview and watch it. I know we don't like to look at ourselves. One of the things we don't even like about Zoom, right? We have to watch ourselves while we're talking. But those are all things that can make you feel more comfortable. And to echo what Lucy was saying, I think that kindness and that professionalism will really help you shine when you're in an interview situation. Thank you. Jessica, I know that you're not doing hiring, but can you share an experience about an interview that you had, and how did you prepare for that?
Yeah, so I mean, honestly, LPN school had like a leadership class, and they really helped us prepare for an interview. So they had us do our resume and a cover letter and do a mock interview, and that was super helpful. Just queuing in on some of those buzzwords that are helpful. Those are helpful. And yeah, it's just, interviews are tough because they're so unpredictable.
Yeah. And, to Lucy's point too, about maybe going to the website of the agency that you're, employed with, and just, perusing the website and understanding a little bit more about the practice will genuinely show your interest in your engagement. I want to pause to make sure that all the questions have been answered. Amber, are we doing okay on questions?
Yep.
Okay. I am happy to talk about educational opportunities, but I do think that our panelists probably have more experience. As you can see, 2 of our panelists came from Front Range, so you know that we have good programs in healthcare, and we're constantly working with students to connect them to the workforce. The type of education that healthcare is what we call career and technical, and the whole goal is to get a job. So I can't talk enough about Front Range's health programs, but Ames Community College up in that area, and obviously the 4-year institutions, UNC and CSU also have health programs. Are there any specific questions in regard to the educational components of getting into healthcare?
And maybe while we're waiting for some of those questions, I'm just going to add, I'm Amber Duchesne. I'm with Employment Services of Weld County, so the local workforce center here in Greeley. I know we've had a couple questions, but I wanted to give panelists the priority here. But as Sandra was saying in the chat as well, we can help assist with short-term certificates per that question about CNA. That's usually around a year. So get with your local workforce center, Larimer, Weld County, wherever might be the closest, and go ahead and reach out to them for that. And then what I do specifically is assist employers with recruiting and hiring. So I'm connecting those employers with the job seekers at the workforce center. So yes, please enter your questions in the chat.
Amber, thank you for adding that. I appreciate that. And then as both Molly and Lucy had talked about, Front Range is very active in the healthcare apprenticeship model. So Lucy and Molly are currently interviewing some of our Front Range medical assisting students to start working with them. So they're getting employed after 1 semester in our program. We have similar programs in the Denver metro area as well in Northern Colorado. So, and let's see, there was a question there. Sandra just commented that Columbine Health has a CNA program, and Salud also has MA programs through NEMA as well. And yes, and all 3 of our Front Range campuses also have MA programs, and then our Westminster and our Larimer campus have CNA programs. Well, let me just go through as we're kind of closing out. And Jessica, is there anything else that you wanted to add to our panelists who are kind of looking at jobs in healthcare, or anything you want to add about your job or your role?
I would say that, an LPN is a really good middle between, a CNA and an MA and then like an RN. So it's kind of like a little bit faster, but it's more money than a CNA, and you still get to do a lot of the stuff that RNs are doing as well. So it's kind of a good middle if you're looking for a shorter education line.
Thank you. I think that's a really good point. Those LPNs are a really critical part of our healthcare system. And like Jessica was saying, in one year, it's similar to an MA education. Molly, how about you? And I know you guys have some interviews to get to, so I want to be mindful of your time, but any last things that you want to add for our job seekers?
I think researching all of the aspects of it. We've seen people who will kind of jump into a program, but it might not be the right program. So the workforce centers are fantastic in helping kind of put a lot of that information out there if you're interested in healthcare in general. And I know it kind of sounds crazy, but starting at the bottom is not necessarily a bad thing. It gives you a great opportunity to really see what's out there and see if that's something that you're interested in, without having to fork out a lot of money. And I will say, just a plug for our community colleges, Front Range in particular has fantastic programs, and they are so cost effective, and wonderful education. So I think utilizing the community college system is a fantastic way to get your foot in the door in any healthcare career.
Thank you, Molly. You can come work for us anytime too. Lucy, how about you? Anything? And I do see a couple notes over here, but let me just get Lucy to do her final comments.
Hello, I know I said it already before, but we need you in the field. So I encourage everybody, you know, we need you, we need your help. There's a lot of good work out here to be done. It's rewarding work, it's hard work, but it's rewarding work. I encourage you to really go out there and think outside the box. Don't think you have to be an RN at the hospital. Think about being an LPN or an MA or an EMT and think big and go on and be an NP and a PA someday. That's great too. But we need you out here. So I encourage you to do it and know that there will be a lot of opportunity when you make that choice and when you hit the field running.
Thank you so much, Lucy. I mean, listening to you guys speak today, it's like, I want to do this and I'm already working in healthcare. So just to answer the questions, so about application for Front Range. So Front Range is an open access institution. So everybody that applies is welcome. The application process is free and you can go to frontrange.edu to apply. As far as the programs, there are specific information sessions in regards to specific programs because there is some screening that needs to be done as far as in order to get into healthcare, background checks, drug screens, immunization records. So a lot of the information sessions talk about those components that are required. And we are starting our spring semester January 19th of 2021. And Molly and Lucy are laughing because they're like, yeah, we've got students coming in, but registration is open right now. So I encourage you to go to our frontrange.edu website and you can look at our academic programs and courses. And AIMS also has some strong programs that include nursing, CNA, surgical technology, sterile processing. So AIMS has some great programs as well.
Chris, I just wanted to throw in there as well in regards to the programs. If you're interested in the healthcare careers aspect, AIMS and Front Range have similar, I guess I want to say education aspects, but they do their programs very differently. And so you can obtain some different certifications in a different manner at AIMS than you do sometimes at Front Range. Both programs are fantastic and they're very similar to each other in the content and the classes that are offered. But sometimes those might work out differently for certain people, or, you know, there's a phlebotomy certificate, there's front office, there's all kinds of things that you can kind of stack onto as well.
Thank you, Molly, for that. All right. Yeah. And Molly and Associates in Family Medicine have been wonderful partners with Front Range and AIMS in offering the medical assisting apprenticeship program. And that gives students that time of learning in the classroom as well as getting the hands-on paid experience while working with associates. So happy to partner with you. Well, I want to thank you guys very much. I know it's a crazy busy time and I really appreciate you taking the time out to talk to our in our virtual chat. I think, Amber, you are going to be able to put the link for the survey. If you have a moment, attendees, to click on that Survey Monkey and give us some feedback so that we can continue these virtual chats in a good format. And if you have any additional questions, I think Amber's going to put that in our the link to our Northern Colorado Health Sector Partnership email. So again, thank you so much, Jessica, Lucy, and Molly, for your time today, for the work that you do for patients and in healthcare. And thank you for coming.
Thank you for having us.
Thank you. Thank you, Jessica. Thank you, Joyce.